over to our next speaker, who is again going to talk around the clinical transformation. Jenny's this is where you've given me the hardest one to say here, actually, Sarah. Interstitial Lung Disease Nurse. I hope I got that right, Jenny. I'm sure you'll correct me when you introduce yourself properly, from Hywel Dda. So, Jenny, if I could hand over to you.
Thank you very much. Yes, my name is Jenny Lynch Wilson, and I'm an Interstitial Lung Disease Specialist Nurse from Hywel Dda, which is based in West Wales. We've got quite good internet speeds here, even despite the fact we're really rural, and I've got a field of cows to my left and a field of sheep to my right, but hopefully you can all hear me and there won't be any problems today. Just to briefly introduce, so interstitial lung disease is a group of over 200 lung diseases characterised really by scarring and inflammation, just to give you a bit of background. So this group of patients really, quite a poorly group of patients, with a quite poor prognosis of a few years or less in some cases. And really treatment options are pretty often limited. So a big part of my role really is managing symptoms with this group of patients, such as breathlessness, fatigue, cough and weight loss. And I'm the only interstitial lung disease specialist nurse for this area. So we've got about 500 patients on our database. I'm probably missing a few. And I would be responsible for managing the nursing care of all this group of patients, potentially. And just to put it into context, so Hywel Dda Health Board covers 3 local authority areas: Pembrokeshire, Carmarthenshire and Ceredigion. And it's the second most sparsely populated health board within Wales, and a very rural area as well. So this means that patients need to travel for up to an hour, sometimes longer, to reach their closest ILD clinic. So obviously this information sort of sets the scene as to why it was pretty important that I felt that I wanted to look at PKB to try and help the communication with this group of patients. Really, today I just want to concentrate a little bit on how I use patientsknowbest with my group of patients, and really look at the impact on patient experience and my experience as well as the clinician. I don't know whether to admit this or not, but really I went into using PKB with very little planning, not really looking at pathways or processes really, and not really having an idea of how I was going to evaluate it or how I was going to use it. So I think it was introduced to me via our service directorate manager, who said that Hywel Dda were keen to use it, mainly from the health records point of view initially, one to try and improve communication around appointment letters, and potentially also to save paper. And I think obviously they realised there was a lot more to PKB that maybe they could use, and they were just looking for a willing volunteer within respiratory, and that just happened to be myself. And I'm happy to do that. Next slide, please. So really just looking at how we use patientsknowbest within our service. My initial aims were pretty simple. I just wanted to improve the communication with my group of patients. As I mentioned, I'm the only ILD specialist nurse. I covered 4 hospital sites across the whole area, with some patients not even able to travel to clinics because they were too unwell. So for me, communicating with my patients was really important, and I was happy to try and look at any ways I could to try and save time myself, save patient time as well, and travel. And the other thing I was really keen to look at initially was just to create a library of information for my patients. So as I mentioned, there's over 200 types of ILDs, and I wanted to try and allow patients to be able to access the correct information, and the PKB library gave me that opportunity. So from the very start, it's been myself who's made all the, enrolling all of the patients. So obviously I had my reservations to start with. How much was this going to increase my workload? It's the same as all of us clinicians. We're trying to save time, not create work for ourselves. But actually, I could see very, very quickly that enrolling patients is very quick and very easy. And I don't find this a problem at all. And that's what I'd like to share with as many people as possible, really. We did have one mass enrolment scheme as well, when I think letters went out to, I think, about 2,000 patients initially within the respiratory department. That was quite helpful as well. Patients were able to agree to hold a PKB record, which would allow them to receive their hospital appointments letters via PKB, but only those who were under a specialist nurse like myself would have access to the other communication tools that we could use within PKB. So just like to share a little bit about some of the messages that are initiated by patients, which will help explain a little bit about how I managed to use PKB really. So often the questions I get via PKB are regarding their diagnosis or symptoms. So as we all know, when patients come in to see the consultants, they might be given a diagnosis. The consultation is quite short, and none of us take in all that information at the time. So, patients then often return home, do a little bit of reading. I always try and provide them with some written information, but often, Google is really helpful to them. And they just come back and they want to ask a few more questions. So PKB gives them the opportunity to do that. They often want to just clarify whether symptoms are normal or not. So patients understand that I don't use PKB as a way of urgently communicating with me. They shouldn't use that. But there are times when patients just want to drop me a line and just say, well, actually, Jenny, I'm getting this cough. Is this normal for patients with my condition? So I can offer reassurance then. There's often other questions, more admin type questions as well about appointments and that sort of thing as well. But looking at the HCP initiated messages, so what do I use the messaging service for, or the email sort of side of things for, and that's often to check whether patients have got any changes in their symptoms. More and more I'm asking patients to monitor things like their weight, their oxygen saturations, blood pressure, because it's surprising how many patients now do hold these types of equipment at home, and through COVID that's increased even more. So really this PKB messaging does allow me to hold a consultation with my patients. And this doesn't need to be planned ahead of time either, which I quite like. So it does mean if I've got, a spare bit of admin time, I can, if I've not seen a patient for a while, I can drop them a message saying, well, how are you doing? Tell me about what's happening with your symptoms at the moment. And then I can get a response and I can read that also, at a time that's sort of convenient for me as well. I can also then, if a patient has rung me and they've been unwell and they've started antibiotics for a chest infection, I can also then respond, in a couple of days with a quick message just saying, well, how are things now? Are things improving? And again, it avoids that needing to plan a time when I'm going to contact the patient, because as a clinician, time is so important. And, with clinics that I hold across 4 hospitals and home visits, fitting in extra time to check on these patients is really quite difficult. As I mentioned, I really started using patientsknowbest without any real planning. So I've left it pretty much, I've worked with patients and we've worked out together how we feel it's going to work for us, really as a team of myself and the patients. And now what I'm finding more than ever is that patients are wanting to share more information with me. So, for example, a lot of them hold Fitbits, or other health devices. And they'll often say, oh, Jenny, just have a little look at this little upload. I want you to see, how many steps I'm doing, what my pulse is doing. Often it's just for some reassurance and some positive reinforcement that what they're doing is correct. And sometimes it can be really useful information. So we've had a couple of patients really concerned about how high their pulse goes when they're exercising. And potentially that might have created a GP visit where I'm able to say, well, actually, look, everything looks fine. It's increasing appropriately during your exercise. It's coming down, you're recovering well. So potentially we might even be saving some GP visits as well from the, I can't call them worried well because they're not a well group of patients, but in terms of, consultations that probably aren't required. I've also used the messaging service. It's been really helpful in patients being able to share photographs with me as well when I've not been able to see them face face to face. They might be quite an hour away from the clinic. So some of the drugs that we prescribe for the particular pulmonary fibrosis patients can cause sunburn or rashes. So it's been quite helpful at times when patients say they've got the rashes. I'll ask them to take a photograph. They've sent it to me, and I've been able to have a good look. And that really helps me decide then whether they need to cease taking the drug or drop the dose. Patients will send me pictures of swollen ankles, all sorts of different, symptoms and signs that they can see, and again, that can be quite helpful. And I think it's putting this back into the patient domain and really making them participate in their own care, really. They also like to share at times letters from other consultants that they've received, or benefit letters if they want some advice as well. Currently within Hywel Dda, there's no ability to share clinic letters directly through patientsknowbest, and patients can't directly access any of their letters or results at the moment. That hasn't been developed. So what I tend to do is, if a patient requires a letter from clinic, or I'm happy to share that, I'll just upload the letter directly, and they'll do the same back with me as well. Next slide. So in terms of impact on patient experiences, there is some data being collected regarding patients' experience, but I haven't got that data at the moment. But this is just anecdotally what patients tell me, really. They really appreciate the fact that they have easier access to me as their specialist nurse. And this was certainly evident through COVID. I should probably point out we were using PKB before COVID hit, and then our usage has actually gone up then. I certainly was one of the health professionals who lost their office during COVID because of difficulties with health and safety and distancing. So much of my time was spent working from home. Or hot desking. So we even had difficulties in patients using our office telephone number to contact me. Certainly those on patientsknowbest had a better experience because they were able to contact me. The other thing patients have said is they really like the fact that they can log in at any time of the day and just ask me a question. And I can certainly see that some messages at 2 or 3 o'clock in the morning, when there's something bothering a patient, they've just logged on and just asked the question. They know they won't get a quick response necessarily to their question, but it feels that it gets off their chest a little bit. And some of them just like to share how they're doing and not even expect a response, but they end their message with, just wanted to let you know how I was doing, Jenny. I think patients say as well they feel really quite empowered, and they really do feel that they participate in their own care. And some have mentioned as well that they've got improved self-management, because what they tend to do is they look back on the conversations and the advice I've given via PKB. So the next time it happens, they scroll through and they find that advice. So it tends to improve their self-management. Certainly the impact on me as a professional has been quite profound, really. I mean, one of the things that has really made a difference is the avoidance of really unnecessary lengthy calls that are sometimes generated through patients. Very sadly, just at a time when through COVID, when all the routine clinics were cancelled, this was a time when patients really felt that they wanted to be in touch with their HCPs more often, and actually they lost that ability. So a telephone call from me would often be half an hour, if not longer, because they were just keen on chatting and talking about everything that was happening with them, which is great for building HCP patient relationships. But actually what I needed to be offering at the time was quite specific advice. So I think it did avoid unnecessary lengthy calls, and I was able to use the messages that were being generated to give quite specific care as well. I can still use the messages to pick up, signs that maybe they do need to be seen sooner in clinic. So I was able to prioritise patients who really needed the care rather than those who were doing very well. And as I mentioned, I use it quite often just to check in on patients if I've not heard from them in a while. And that's certainly saved on clinic time, because if a patient comes back and says, actually, do you know what, I'm doing really well, thanks for being in touch, symptoms are all fine, then certainly what I've done is I've postponed clinic appointments, which has been really helpful. Next slide.
Jenny, just to let you know, you've got about 5 minutes. Perfect, thank you.
Okay, so this is the next slide talks about the main development we've used PKB for in the last sort of few months, really. Some of the medications we use are immunosuppressants with our patients, and these need to be monitored quite closely because they can have quite difficult side effects, and also we need quite close drug monitoring as well of these patients. So prior to the use of PKB, this would usually generate a face-to-face clinic appointment for drug counselling, and then probably at least another 2 clinic appointments to discuss side effects and effectiveness of the drug. Whereas what we've done now is we've now work with an advanced pharmacist as well, and we run our new sort of drug monitoring clinic by using patientsknowbest. So we're still in early days. I think we've got about 15 patients now, and I think of those 13 are using patientsknowbest that we share their blood results with and talk about side effects. So what tends to happen is we hold one telephone call with the patient for the drug monitoring, and then we enroll them with PKB, and we're now selling this as standard care. Standard care is now patientsknowbest and not necessarily telephone call, but of course we allow patients to say we don't want to use it, we just prefer telephone call, but the majority of patients are happy. So in terms of impact on the patient experience, they're really grateful to have access to 2 different healthcare professions. So they can ask a question about drug interactions, for example, that is more suitable for the pharmacist to answer. And then they might ask a more clinical question about symptoms or side effects that I may well then answer. So they like the fact that the message comes to both of us, and that's the way we've set it up. What's been really useful for the patient and for us actually is that we're now prompted to check their blood results because patients now tell us when they've had their blood test performed. Obviously, COVID has made it very difficult to arrange blood tests, and many surgeries are not using their phlebotomy services. So whereas we want patients to have blood tests every 2 weeks, patients are responding to us saying, look, the GP just can't do it for 3 weeks, or, it's a bit unpredictable. So now they let us know when they have the blood test performed. That then prompts us to check the results, and then we respond to the patient, usually within 24 hours, with the result, which they're very happy to receive. Also, in terms of impact on us, it's saved us a lot of time in checking results, because if you wait for paper results, that could be a very lengthy process. And then even checking online, logging in and checking for bloods, and then just to find the patient hasn't had them done that. So it saves us a lot of time when they prompt us to do this. It's also been really helpful in terms of clinical supervision and learning opportunities between myself and the pharmacist, because we review each other's advice, and that's a way of learning as well. Next slide. So I've mentioned probably already how COVID affected the PKB use, and really that was around the cessation of all routine face-to-face clinics, just when there was a need for these patients to want to communicate a lot more with the health professional. Pretty much all of my patients will have been on the shielding list. And will have received shielding letters, and this was of a great concern to a lot of them. So those that were registered on PKB found it a lot easier to ask quite specific advice on, whether they could go out, when they could go out, wearing masks, where to get tests, which was a little bit more time consuming initially, but at least I felt that they were able to ask their main clinician about this. We also uploaded rescue antibiotic plans, so I could any patient who had any extra symptoms, I could direct them to these plans, which would give them some more information about when they should take their antibiotics. Certainly from the impact of the professional, I had increased confidence that more patients would want to use PKB. Because patients learn to use their digital devices a lot more. They use Zoom. So for me, I encouraged more patients to enroll with PKB. Obviously improved communication, and also I was able to record the clinical interactions as well, by sometimes copy and pasting onto our Welsh clinical portal clinical notes, which meant that I had a record of the advice that I'd given as well. and certainly increased our use of home monitoring, as I mentioned. So many more patients were buying equipment like pulse oximeters, and certainly I was able to spot when patients were had some disease progression and their oxygen levels were dropping, and that could even mean initiating some form of face-to-face clinic or arrange for the oxygen nurse to visit them at home. And certainly weight loss was a big problem as well. So again, involving dietitians. So certainly the use of PKB and the ability to use digital health equipment to record on PKB through messaging or through other manners made it easier for me to improve their care, really. Next slide, sorry.
Jenny, we're just running over ever so slightly, but I think everyone's really enjoying this. So if we could maybe try and wrap up in the next couple of minutes.
Yeah, no problem.
We've got a couple of questions, but I know everyone's enjoying it, so I don't want to rush you along too much.
I'm very grateful for Olivia to putting some of these up, really. This is some results, really. So as you can see from this slide, the PKB usage. So I was quite surprised to see 73 patients use it regularly over the month, out of probably about 120 or 130 have it. And over the 2 years, 2,070 messages. And as you can see, it's about 50-50 patient and professional. Next slide. Again, this is quite self-explanatory and mentioned in my talk that PKB usage has gone up in the last 2 years over COVID. And actually that's sustained because we're continuing to use it more often. Next slide. I was quite interested in this myself, actually, in terms of message read time. So you can see about 80% are read within about 48 hours and responded to. We've got a few there that are a bit longer, and that probably reflects in the fact that I work alone. So actually, when I'm on sick leave, it would be the consultants that would manage my caseload and support, and they don't actually use PKB. So I think, we do need to note that there's limitations when you're trying to manage PKB as a lone worker, really. And I believe that's my last slide. Well, just a little bit about the PKB in the future. Very much, as everyone has said, increase the use of monitoring patients at home, improving communication, really. And it would be great for us to be able to integrate it with other health systems so that the patients could receive their own results and we could give them some guidance on interpreting them. But that's not happening at the moment. And there's my next slide. With my lovely pug. So I thought you might like to see a picture of my pug, considering it's the pug group. Okay, if you've got any questions.
Thank you, Jenny. We've had a couple of questions come in, so I'll go through those first. So the first question is, are you saying that you have a group phone call with patients needing the same information? Do you consolidate those into group calls?
It's not something we've done, but we have considered doing that actually for pulmonary rehabilitation. But no, we've not sort of included any group patient conversations at all. No, that's not something we've done.
Okay, thank you. And then the second question was, do you think you know your patients better, even though some of the lengthy calls have been reduced? Have you had to proactively build up the trust, or has that emerged naturally?
Yeah, no, that's a good question, actually, because as you know, it is very important to have that interaction, get to know my patients really well. I think because we were using it before COVID, when we still had the face-to-face clinics, I was able to build those relationships before, and then they continued then through PKB. But actually, some people share a lot more information remotely than when they're face-to-face as well. And certainly more difficult conversations are sometimes held through the messaging service as well. So I haven't felt that I've lost any of that relationship, really. In fact, some of the patients that have been enrolled during COVID, it's been lovely to finally meet them in clinic. And it's almost like we're old friends, because I know sort of so much about them and so much about their symptoms and their wife, and their family. And actually then I finally get to meet them, which is always great. So, the best of both worlds is face-to-face clinics and some other form of virtual as well.
Great, thank you. We've just had another question come in from a specialist respiratory nurse, soon to be a clinical lead for this in Sussex as well. She's very interested in using PKB for direct messaging without the long clinical calls. Apparently they've had 2 during this meeting. So it sounds like you've done really well with this, especially during COVID. Can they contact you to discuss further?
Of course they can. Yeah, absolutely. I don't know if there's a way of giving out my email address. But
we can pop it. We can pop it in the chat if you're happy with that, Jenny.
Yeah,
I'll pop it in, and we can circulate them afterwards. So that's really appreciated.
Of course. No, I'd welcome that. It's fine.
Brill. Thank you.